Welcome to today's meeting of the Fire Resilience and Emergency Planning Committee. Please may I remind participants to turn off your devices or put them on silent. Members of the public may like to follow at London Assembly on Twitter and use the hashtag AssemblyFire for this meeting. On the agenda today is a question and answer session with the London Fire Brigade and the Deputy Mayor for Fire and Resilience. However, we have some short items of business first. Can I now ask our clerk, Diane Richards, to confirm any apologies for today's meeting?
Thank you, Chair. No apologies for absence have been received, but in accordance with Standing Order 2.4, Assembly Member Leonie Cooper will attend the meeting virtually.
Many thanks. And I would take this opportunity to thank our the chair for last year, Susan Hall, who so ably chaired this committee, and I thank the fellow Assembly members for entrusting me to chair the committee for this year. Can I remind everyone to put their devices on silence? Thank you. Can we note the list of offices held by Assembly members? Noted. And can I also ask members if they have any disclosable pecuniary interests in the specific items listed on the agenda? No, there are none. Thank you. And can we note the membership and chairing arrangements for this committee as agreed by the London Assembly at its annual meeting on the 9th of May 2022?
Noted.
And can we note the committee's terms of reference as agreed by the London Assembly at its annual meeting on the 9th of May 2022?
Noted.
And can we note the standing delegations of authority to me as chair of the committee as agreed by the London Assembly at its annual meeting on the 9th of May 2022?
Noted.
And can we confirm the minutes of the committee meeting on the 3rd of February 2022?
Confirmed.
Thank you. And can we note the completed ongoing and closed actions arising from previous meetings of the committee and the additional correspondence sent and received?
Noted.
And can we note the action taken from the former chair under delegated authority in consultation with party group lead members, namely to agree the committee's letter to the Secretary of State for Levelling Up, Housing and Communities regarding progress on recommendations from the Grenfell Tower inquiry?
Noted.
And can we note the response from the Minister of State for Building Safety and Fire to that letter?
Noted.
That brings us to our main item of business, a question and answer session with the London Fire Commissioner and the Deputy Mayor for Fire and Resilience. Can I welcome our guests and thank them for joining us today? We have Dr. Fiona Twycross, Deputy Mayor for Fire Resilience, for Fire and Resilience, and Andy Rowe, the London Fire Commissioner. And supporting the Commissioner from the London Fire Brigade, and I welcome Kate Bonham, Assistant Director for People and Services from the London Fire Brigade. I'm going to start with the questions and then I will hand over to colleagues. Welcome to you all. My first question is to you, Andy. Have the terms of reference for the culture review now been finalised?
Thank you, Chair. Can I just, before I answer, just record on our welcome to yourself as the new Chair and record our thanks particularly to the previous Chair, Assembly Member Hall, and for actually all her years of kind of interest and service to us as an organisation. And I'm very pleased to see you here again. And I know that interest will be keenly maintained. I'd like to welcome new members as well. Len, who of course knows much about us, has an equally long relationship, and Sem. So just really glad to see you all on the committee, and we thought we should record our thanks and our welcome in that regard. In terms of your question, yes, because the culture review is very much underway. So the terms of reference were agreed prior to Christmas last year. Nazir Afzal, who is leading the review independently, started that process back at the tail end of 2021. They have completed their survey already, so that's reached out to well over 1,000 staff. He intends to engage with at least 2,500 of our 6,000 employees. He's already beginning to unpick, I think, some of the issues we will have to deal with when that report lands. So I think the answer is that, yes, absolutely, terms of reference are agreed, but more importantly, the review is very much underway.
Okay, that's excellent news. Are you able to share a copy of that with the committee?
The terms of reference? Yes, of course.
Okay, wonderful news. Thank you. And how has the London Fire Brigade and its staff fed into the review so far? And what further input are you anticipating?
So I think Nazir is running as broad a possible review as you could imagine. So he's trying to engage with people on all levels through survey, through individual meetings. So, for example, he's already met with pretty much all of the significant figures within the Grenfell community. He's met with the family of Jaden Matthew Francois Esprit, and he has invited in people who have particular issues and has started to meet them, whether that's in the context of gender or race, other protected characteristics or other issues that we're aware of and have made him aware of prior to the review commencing. Obviously, there's been the survey, and he's now in the phase where he's beginning a very wide-ranging focus group process, visiting fire stations. He has a team working for him. But I think what I would clarify is he is genuinely independent. He is supported by a team that he brought in himself. He has an office in a TfL building. And really, what we've done is open the doors up to Nazir to work across the organisation without any barriers.
That's wonderful, thank you. And Fiona, how are you feeding into the review?
I've had an initial introductory meeting with the Chair, Nazir Afzal, and I will be giving formal feedback probably towards the end of July, when he's done quite a lot of the groundwork. As the Commissioner said, Nazir is speaking to a lot of people himself. He's got people working with him who are also talking to people, and they've carried out an extensive survey which has had quite high levels of response. So I think that I'll be feeding in at that point. What I think the Commissioner didn't mention was we do have a sort of safety valve thing. So although it's an independent review, we have got a commitment from Nazir as who's leading the review, that if he comes across any issues that are significantly serious that he needs to raise them with the Commissioner, he'll do that as he goes along rather than wait until the end. As you may be aware, he's hoping to conclude the process and publish the report in the autumn. Thank you.
Thank you. Assembly Member Hall.
Thank you, and thank you for your kind words, Andy. Do you have any further indication on the timescales for completion and findings being actually published?
Yep, so Nazir is planning on presenting his findings to the Brigade by November 2022. I would imagine we will because we're engaged in the process, we will very quickly after that date ensure that all stakeholders, yourselves particularly, but also central government, will have sight of that report, and we will be transparent in publicising that report as well. I think it's very important that, having asked Nazir to come in, and with a great desire for us to take a grip of our own culture, recognising there are issues, that we are utterly transparent in what we find and therefore what we intend to do and what we are doing.
That's good to hear. How are you sure that will stay on track? How are you making sure November will be the date?
So we've got an embedded liaison officer. So I think some of you will know Pamela Operacha, who has worked in my office. She's supporting Nazir directly as that bridge between LFB and the review itself. I get a regular monthly update on progress. We've got clear deadlines set within the review process and the terms of reference, and I expect to hold to that. Nothing I've been told so far leads me to believe that schedule will slip, particularly because Nazir knows how important this is to us.
Yes, no, it is vitally important. We don't want another crossrail situation where we think something's about to be delivered and then it's not. So it's vital that you keep on top of that. So I'm pleased to hear that. Can you outline the detail of the proposed operating protocols that were put forward to provide a structure for London Fire Brigade and the Chair to work together, and have they been agreed?
Yes, again, they're covered within the terms of reference, which obviously we'll provide to you. But really, it is a standalone review. So whilst I catch up with Nazir informally, and I will have a formal interview myself, he's pretty much out there operating on his own, because I think it's very important that when our own staff look at this review, and that when London looks at this review, obviously through your scrutiny, there is a genuine sense that it is independent, that I have not been able to influence, that I have not been able to kind of direct. And obviously he's a fiercely independent figure anyway. His reputation stands on that. And that's really what the terms of reference set out. So actually my contact with Nazir is fairly minimal. other than to check that we are keeping on that set of deadlines and that he is going to deliver a review within the timescales we expect.
Good. In the meantime, we all know there is a culture issue. We've spoken about it many times. So how are you and Fiona actually making sure that measures are already going in place to address this? Because we can't wait till November.
No. I absolutely agree. So I think as much as the review is extremely important, it would just be disingenuous to pretend we don't know what many of the issues are ourselves. So there is a range of interventions in place. I mean, if I could turn to Kate, and perhaps, Kate, you can lay out the detail of everything from our leadership to our kind of cultural awareness workshops, all of the sort of things you would imagine we were doing, but perhaps you could give more detail if you think that's appropriate.
Be interesting. Thank you.
Sure, I'm happy to, and thank you for having me today. It's really good to be here. So there are areas, although we don't want to influence at all the outcome of the culture review, as the Commissioner said, it's really important that we let that play out and be independent. We do obviously know that there are some areas for concern through our staff surveys, our conversations with the quality support groups, etc. So the main areas we're focusing on are leadership, so improving the leadership capability of staff at all levels. So we've got a programme in place now for supervisory leaders, also for middle leaders, for top management group, and also a programme rolled out to all staff, helping them to understand our LFB behaviours and to exhibit those in practice. So leadership is a key priority. We also continue with the work on our togetherness strategy. So that's essentially around building a more inclusive culture and making sure we represent London. And we're making good progress in many areas, from improving the diversity of our firefighters through to the work we're doing on training our staff. We've got a new e-learning now rolled out on inclusion and neurodiversity, and we've got a series of different face-to-face workshops around leading with authenticity, assessor training for promotions and recruitment, etc. We also know that some of our staff are nervous about coming forward around experiences they might have. We know that from what we hear from our quality support groups. So that's why we've put in place the Safe to Speak scheme, the pilot of the Safe to Speak scheme, which is based on the NHS Safe to Speak Up Guardians. That's been piloted for the last 6 to 8 months, and we're just reviewing the effectiveness of that now. We're also looking at some of our HR policies, so our discipline policy, our grievance, and our bullying and harassment policy. And that's partly to increase people's confidence in coming forward, confidence in the process for raising concerns, but also to improve our managers' ability and capability and the tools that they've got to manage lower level behaviours. We have a discipline approach which some might say leads us to either disciplining quite heavily or perhaps not disciplining. We have some managers who do this very, very well, and we have others that don't. And what we want to do is have a discipline approach which enables managers to nip things in the bud quickly, deal with lower level behaviours before they escalate, and that's what we're focusing on. So that's a bit of a flavour of what we're doing already.
Okay, this safety speech scheme that you've just mentioned, how many people have interacted with that?
So we've had a good number. I don't have the exact numbers, but I can send those to you afterwards.
Approximately. I mean, yes, please send us the proper figures,
yeah.
But are we talking tens, hundreds?
Tens.
Tens.
Yeah, in the tens, yeah.
Okay.
Not over 100.
So given that there's so few in that respect, you can look into each one in far more depth.
And we do, and every case is looked at individually on a case-by-case basis. Sometimes people just want to share their experiences, they don't want any action taken, and then we've fed that back into, for example, recruitment processes, promotions processes. Sometimes somebody does want action taken, but the reason they've gone to that area is because they're nervous about raising it formally. So then we work with them really closely to find the most appropriate route to do that, whether that's through speaking to the relevant borough commander, the relevant manager, but with their consent and permission. Sometimes that takes a bit of working through, but then we also collect that information cumulatively to then feed into the wider work that we need to do. So if people aren't confident in coming forward officially, why is that? And what do we need to change about our overall system to prevent that from being the case going forward?
Okay, so if somebody phoned you, phoned this safety speak thing, and the content of what that person said was really quite alarming, how quickly do you get to hear these comments are through, and how would you deal with that? If it was somebody on station and they said that, you know, they were frightened of speaking out loud, but they as an extreme example, feared for their lives, So if I was to do that on a Monday morning, when would that be picked up by the brigade?
It'll be picked up immediately. So we have a dedicated Safe to Speak inbox with a dedicated staff member who monitors that with contingency arrangements in place. So that is dealt with immediately. And then that individual will take the necessary action, and that will depend on the situation. That staff member is fully trained with the NHS Safe to Speak Up Guardian programme, so is trained with the various different actions that you take depending on the situation.
Okay, I'd be really interested to hear more of that, because because you never know which way to go with it. Because if it's that urgent, then clearly it's going to be noticed on the station, because you'd have to, I assume, remove that person from...
Exactly, and we do that. If that's what we need to do, we do that. We're about to do the full evaluation of it, and I'm happy to share some of the outcomes of that at future meetings.
I certainly would be interested in that. How many staff have attended the cultural awareness workshops?
I don't have the figures off the top of my head, but we've run, in the tens of workshops. We prioritise them at our model fire stations. And we're again actually about to do a review. I've got a meeting this week to look at how they've gone and consider how we roll them out more widely.
Could we have those details? It'd be
sure.
interesting, given that you've got 6,000 employees, I hear, but there are always about 4,500 active firefighters. Is that still around the same amount?
Apologies, 4,700.
Yeah.
Could I make a point, Susan?
Yes,
in that
please.
I think I completely understand where you're going with the questions, which is how far have we got with this? I think we've got to be clear with yourselves. We're at the start of something here. We know we've got issues with our culture. We know we've got considerable improvements to make to ensure everyone is safe and dignified. I don't think we're close to getting to that space. I think we've got the right mechanisms in place. I think we've got the right interventions in place. But I wouldn't sit in front of this committee for a minute and pretend that we have hit the coverage we need to. Some of that's down to COVID. Some of it's about the sheer scale of change we need in the brigade. But this does sit at the centre of it, because what I'm very sure is unless our staff have trust and confidence in their own organisation, we're not going to see the improvements we want. And I do think we have, in quite a lot of places, a trust and confidence issue. You know, I've been out across just over 30 of our 100 fire stations on the visit schedule I'm on. It is very clear to me when staff speak to me that they have their own concerns around our culture, how it's going to be dealt with, and they want that trust and confidence restored. I think it will take more than this review, and it will not be measured in months, but it'll be at least a couple of years before we get to a place where I can confidently sit in front of you and say we've really turned the ship on this, because I think otherwise what I'm doing is glib. I'm touching the surface. I think we've got something that's built up over a very long time, where you've got really good people in the organisation. Now, the vast majority of my people are good people, but we have got elements within our culture that undermine the good teamwork, undermine the sense of pride and service, and it will take time to root them out and restore confidence, I think, in the organisation and trust across all of the workforce.
Fiona.
Thank you. So I think the Commissioner's right, but what I wanted to add to this was obviously he is going out and talking to firefighters direct, and I think it's part of that sort of getting the commitment about a culture change that is very evident within the senior team, and making sure that people understand what that means for them on a station. And there's some tangible improvements that that people are already in the process of about to sort of be rolled out. So the culture review was initiated because of the internal investigation into the tragic death of Jade and Francois Esprit, as you'll be aware. But there were quite a lot of process issues that were identified that were undermining sort of positive culture on stations. So, for example, at my board yesterday, we heard about a new transfer policy that would enable people to more easily move stations. And that's part of the culture shift, is not just seeing a firefighter on a station as a resource for the fire brigade, but recognising them as human beings as well as a human resource, if you like. So when that's rolled out, I think that firefighters will start seeing a positive shift, that when they request something that feels quite straightforward to us, like sort of a move to a different station, that should be easier, because we had people who'd been on transfer requests for over a decade, which is simply unacceptable, and just reinforces that sort of sense that people's needs aren't recognised within the sort of organisation. So I've been pleased that some of those process issues have been addressed. But again, it will take some time before firefighters actually trust that that's something that's going to be there permanently, or will be embedded permanently, I think. So it is a trust issue, but I think I am confident that the culture review will highlight issues that I think the Commissioner and his team are probably already aware of, but we have to make it solutions-based, and some of the things may be, we may need to make sure some of the things happen faster than others, because I think the Safe to Speak scheme that Kate has talked through has identified some serious concerns in some instances. Yeah,
absolutely, and given the suicides, etc., that's why I'm concerned when I hear what you say, 2 years, but there is a no. Well,
I'm talking about sort of outcome. So I think we have to do stuff now. I think you're absolutely right, Assembly Member Hall. It's not about waiting for the end result of the review. It's not about waiting for this outcome. It's more a recognition, and I think I've learnt this really over the past 2 years, that if you really want genuine culture change that's beneath the surface, that's beneath, projects, beneath kind of a narrative of change, so actual cultural change, where people are really fundamentally experiencing the workplace in a different way. I think in an organisation like the London Fire Brigade, which is a big, old, uniformed institution, I'm afraid I think it does take years rather than months, because we're dealing with generational ideas of what the service is. We haven't invested in leadership for a very, very long time. When I became Commissioner, the previous formal face-to-face leadership training I'd had, courtesy of the London Fire Brigade, had been as a leading firefighter 15 years earlier.
I'm aware there's an awful lot that needs to be changed. We're reversing
a considerable lack of kind of attention to the area of good investment in behaviours and leadership. We didn't have a behavioural code. We didn't have a value system. I mean, I'm afraid I think it will take time.
I think you're right. Can I just, very quick answers, because I'm mindful of the time. How many staff are members of the neurodiversity staff group?
I don't have the figures, but I can send them to you afterwards.
Approximately?
Really it would be probably in the tens. I wouldn't say it'd be over 100, but I don't want to be held to that. I'll get you the information.
Okay. Has the full staff survey been completed? I think you said it would be done in the spring.
We delayed the staff survey because HMI CFRS were conducting their own survey. Nazir was conducting a full staff survey. So in conversation with both HMI CFRS and Nazir, we held back on our own because, to be honest with you, there's survey fatigue. We're gathering that much information. So, Kate, could you perhaps provide the detail of when we do plan to roll that out?
Yeah, so we're planning to roll it out in September this year, but in the run up to that, we are looking at an onboarding survey, something specific for people who have just joined the organisation, which is a really important part of us understanding people's experiences in their first few months, whether that's as a trainee firefighter or in any other role in the organisation. So we're doing that targeted survey in advance of the full rollout in September. And that means we've got clear sort of water, I suppose, between the previous HMI and culture surveys for our staff to be able to focus on the all-staff survey, and then we will be doing it annually with pulse surveys in between.
Okay. What I would say, though, Assembly Member Hall, is that obviously, effectively, 2 whole brigade surveys have been done in the period, which is one by HMIC FRS independently and also Nazir, both of which will offer different results in different areas, but we will, of course, bring transparently to this committee because they are a very important set of findings around the brigade across the whole of the staff groups.
Okay, and lastly, how will you measure the impact of the training sessions and webinars that you've begun to run to support the culture review work?
We have to see tangible differences, so we've got to see less discipline, less grievance. Actually, when we go out and do the survey repeatedly, when we do the pulse surveys, we've got to hear people telling us a different story. So if we go out and we talk to 2,000 staff and they're telling us the same thing, then I think we have to go back and look at what we've delivered and question ourselves and seek to change and improve it. So I will judge it in terms of tangible reduction in the things that are most obvious, from, you know, grievance, discipline, lack of proportionality in terms of promotion, access to opportunity, seeing the data actually change, and then what our people tell us. Because just to deliver a programme is meaningless unless you actually get an outcome for our staff and then communities.
How will we know it's working? Because it's what the staff are telling you, but as a committee, we are the ones that are having to ask you how it's going, and you will know, not when you were here, Andy or Fiona, but those of us that were on the group before overseeing the fire brigade were told untruths, quite frankly. So we need to know that what we're being told is correct.
That's absolutely right. The approach we're taking to the CRMP for that we're consulting on at the moment, or about to consult on, around the targets that we're working towards. So around people and culture, we will now have and we kind of call it internally, a True North KPI, really, a measure from the staff survey, which is, would you recommend LFB to your family and friends? And we've not measured that before publicly, but we will now be measuring that in the CRMP alongside some other headline figures that give us an indication of the health of our workforce. Then supporting that, we'll have a number of internal process measures that we will look at that will feed into that overall KPI. Obviously, that's subject to consultation, but that is one way that we will assure yourselves and also assure the public that we are making progress in that area.
Yeah, can I just comment on that? One of the issues with that is that clearly things have been going wrong because we need this cultural review. But equally, all the way through that, I happen to know there's numerous fathers and sons and daughters working for the brigade. So will you recommend it? They have been all the way through. So I don't think that's necessarily going to tell us much.
Could I just make the point about the inspectorate? I lead in a different era. So I'm the first commissioner to lead in an era of total inspection, and I think one of the things we need to think about is how we make sure that the information that HMI CFRS gathers and is gathering is brought transparently to you as well, because, you know, if I think about our inspection towards the tail end of last year, that's over 20 plus station visits by a team of inspectors, a completely anonymised staff survey taken independently of us. You know, inspection's tough, but it's the single best lever that has come in nationally to drive change. I'm really glad that we are an inspected organisation now. So I think some of the reassurance we'll be able to provide yourselves is that you don't have to take our word for it anymore. As much as we will be utterly transparent with you, that's something that's profoundly important to me in terms of my own values. I think that your sense check comes from the other measures we've put in place, such as the audit committee, the independent operational assurance advisor, who's going to take a wider view of the brigade as well in terms of providing information, and I think the inspectorate itself. So I think there's layers of additional scrutiny, and of course, I think, to be fair, the Deputy Mayor scrutinises us in a really robust way, taking into account some of the things that have occurred in the past.
Yes, she does. She was on LFB with me, and we were both told incorrect things about the brigade.
Yes, and I think there's a legacy of trust that I think I recognise, because obviously I was on Lfb as well, Assembly Hall, and I think that one of the things that when we have interviewed the chair of the audit committee, when we interviewed the independent operation assurance advisor, we did say to them that there might be a point at which the Assembly would want to call them to speak to them direct. So I would encourage you to sort of consider that in the future. They'd be more than happy to. They literally got asked it as a question in their interviews. It wasn't even something we added on afterwards. So I think that that should help you correlate. I've been to the audit committee. They ask really difficult questions as well. The independent operational assurance advisor gives really tough feedback. These measures sort of have helped me in my scrutiny of the brigade, but I think they also help the Commissioner understand where the real knotty issues are, and they'd be more than happy to come along and speak to you. And I know that on probably on a more informal basis, the brigade would be more than happy to facilitate conversations with some of the support groups as well. I know that the representative bodies already speak to some of the Assembly members already, and I know that's a useful route into understanding what some of the issues are. But this will help you triangulate sort of what you're told in these formal meetings by us.
Lovely,
Thanks.
thank you.
Thank you. We're now thank you for that very helpful insight into the culture. We're going to move on now to mental health and well-being, where Assemblymember Hall is going to start off with some questions, and then we're going to turn over to Assemblymember Bakari.
Sorry, it's me again. Right, I am indeed. Staff sickness for operational staff has been on an upward trend since August 2021 and reached its highest level in Q4 of 21-22. Do you know what is driving this increase, and what action are you both taking to address it?
In terms of the headlines, we're unpicking it at the moment because that's not something we want to see. I'm going to let Kate give you some of the analysis of what we've unpicked so far, but just to be clear, it is yet another area that we will need to improve on, and we've got to drive those rates down and understand how we might do that. So please, Kate.
Thank you. So there's a number of different reasons we think why sick absence has increased. Partly it's directly due to COVID, so increases in short-term absence, particularly because of COVID. We also have the indirect influences as well. So, for example, we're seeing some of our long-term sick absence cases. We're seeing delays in people accessing the treatment that they needed to receive from the NHS due to wider delays in the NHS related to COVID. And we've also seen, particularly with FRS staff, an increase in stress, anxiety and depression related to COVID. And this is supported also by what has come through to our counselling and trauma services, where we've seen actually a 32% increase in staff accessing counselling and trauma over the last 12 months. Now, the insight that the team have given me is that that's twofold, really. You can look at it in two ways. In some ways, that is primarily to do with an increase in people's personal stress, anxiety and depression they're experiencing in relation to COVID, in relation to bereavement, etc. But it's also a marker of perhaps people being more confident in coming forward. We've really increased the awareness around mental health throughout the pandemic, but also wider than that as well. And what they have seen is that actually this is a result partly in people feeling more confident to come forward and more knowledgeable about CTS. So there's a range of different drivers for why we're seeing that increase, but that increase is unacceptable. So what we're doing is we're at the moment just finalising our refreshed wellbeing strategy, and that strategy takes us from a position where the brigade has been very, very good at focusing on the treatment of staff with poor psychological health, poor physical health and poor workplace health, whereas this focuses much more on the promotion of positive well-being, positive mental health and physical health, and the prevention and early identification of poor mental health and physical health. And so this promote, prevent and treat model will be the framework for all of the work we're doing. But lots of it we're already underway. So, for example, we are bringing in a new health and wellbeing policy. This replaces our old sick absence policy, which until very recently was actually part of our discipline policy. This health and wellbeing policy is all about early identification, early intervention and support early on to prevent people from actually going off sick. So, for example, our current sick absence policy only actually recommends that a manager considers reasonable adjustments or workplace adjustments once they're already off sick for a number of months, whereas actually our new health and wellbeing policy recommends that managers look at that much earlier on when they first identified somebody's kind of a wellbeing kind of position at that time, put in interventions early on and actually prevent them from going off on sick. So that's a flavour of that transition. We're looking at that will be rolled out in the summer with training, but alongside that we've also now rolled out our new Recognising Stress, Anxiety and Depression face-to-face training for all managers. I went on it myself on Friday. It was brilliant. A pleasure actually to be in a really mixed group from firefighter through to senior officer, FRS staff as well. And that was really focused on tangible, practical ways to identify the signs and symptoms of stress, of anxiety and of depression, and then to put in place practical solutions to support somebody. That looked at some low-level stress, but it also looked at when that gets much more serious, through to a situation where someone might be disclosing to you that they've got suicidal ideation or perhaps are considering taking their own lives, and how you deal with that in that moment and more generally as a manager and leader. So I'm really proud of that progress, actually, and that for the firefighters and the staff in that room, that felt like a real step forward for us as an organisation. And in terms of building trust, I do feel like that group left the room and said and felt that we had listened to their concerns about this. In addition to that, the last couple of things I'd say is that we're also looking at much more local work, because as we know around particularly mental health, the immediate support you have around you on a day-to-day basis is actually the most important. So we've rolled out around 100 mental health first aiders, with under 120 waiting to be trained soon. We're also looking at a network of peer trauma supporters who focus specifically on when somebody has experienced trauma. And we're also looking at local wellbeing partners, which is a much more sort of informal approach, but essentially it's a person who's the lead, the champion for wellbeing in their watch or in their team. And they provide a kind of route, raise awareness, help be the join between the central wellbeing team and our staff on the ground. And then the last thing I'd say is that the restructure we're doing of HR and the implementation of HR business partnering, having worked in HR in a range of different organisations, HR business partnering will be key to us being able to look at our staff survey data, our workforce data, and work with our leaders to design targeted strategies to reduce sick absence. At the moment, we don't have that ability to do that because of our structure, whereas this will be a real step forward. So every leader will be responsible for looking at the absence in their area and coming up with strategies to reduce that absence, and that will be supported by a professional senior HR leader.
Okay, well, that's all sounding very positive. This is going to sound a bit harsh, but I do know that firefighters have said, because they can never get holiday when they want it, the way they used to deal with it was by going off sick. Now that sounds harsh, but it's right, Andy, isn't it?
Of course it is, yeah.
And that used to drive sickness levels up in August, shockingly. Now, the way to deal with that is to work out the rotas and have spare people. Have we looked at it in that?
Yes. So I think you're spot on. I'll just, again, I would need to be transparent with this committee. That is definitely an issue. That will be driving it, because we, of course, as this committee knows, have a workforce planning issue. Which we are closing the gap on. By December this year, we will have brought in nearly 300 transferees from other brigades to plug skills gaps, which means that people can get their holidays. We are engaged again with the support of colleagues in the GLA on a full recruitment round, so that will close the gap. So over the next few months, that situation will improve, and I do expect it to have an impact on those figures as well, because you're absolutely right, Assembly Member Hall, that is also another factor in those figures.
Well, it is, and I wouldn't want that to sort of shift the thought that so many firefighters are actually ill, when actually they want to go on holiday and they know they wouldn't be given the time, because that implies that it's not a very healthy place to be. So if I could just put that in there.
No, I think it's correct, because it's an additional pressure on staff. They deserve to have leave. You know, if we haven't sorted out our workforce planning, that's a pressure that also contributes to poor mental health, to poor work-life balance. So I think we have to take that seriously, and we need to attack it on all fronts. Good.
Okay. What has been the response to the mental health webinars?
It's been good. I will be transparent that we haven't had as much of an uptake as we'd really hoped for. And we've done recently a lot more promotion work to try and get the word out there and encourage people to sign up. Part of that is sometimes due to the timings of the webinars, so we've listened to feedback on that, because it might be not suitable for people that are working shift patterns, and obviously our firefighters' shift patterns. So we've started to schedule them at different times. So the uptake has been good, but it's not been as good as we'd really hoped, and that's why we're really focusing on increasing awareness of them.
Okay, how many have attended?
I don't have that figure, but
okay, can I ask you, when you come in front of us again, I always ask these questions, how many, because it gives us an indication of whether people want to get engaged or whether there's a big issue and everything else. So can we always have those figures?
I think that's a fair challenge, and we'll make sure we do.
Thank you. What does LFB's new Working with Choice policy seek to achieve?
So our Working with Choice policy is around really, partly it was kind of learning from some of the really good parts of COVID in terms of us being able to work from home and making the best use of that flexibility. But really, the Working with Choice policy aims to enable the individual's choice around what works best for them and how best they work to match better with the organisation's a kind of way that they would like their staff to kind of work. So the Working with Choice policy recommends that our staff spend about 40% of their time in an office-based environment in order to make best use of the collaboration, the benefits of being in person with their colleagues. But it really puts that choice on them to determine where they best do their work. So when they're in a team, when they're having a team meeting, when they're brainstorming something, when they're trying to solve a problem, that's best done in person, perhaps. And that's where that 40% comes from, because a lot of our roles involve that on a day-to-day basis. But also, if they feel that on that day they've got particular work that involves them focusing, then it would be better for them to be at home and make best use of that. And it also enables people to manage their work-life balance better as well, which is something that our staff have really shared has been a benefit to increase flexibility. So that's the aim of that policy.
Could I just add something to that, if possible? The other thing as well is that we're in a very competitive recruitment market, where the expectation, particularly from younger workers now, is that you do offer some sort of hybrid working, and you will not compete in the market unless you do. It's very clear from the feedback we've had through the kind of recruitment agencies we use, through our own recruitment campaigns, that if you don't bake that in to the kind of terms and conditions that you offer, we're simply not going to compete in the open market. No. But obviously that's got to be balanced against needing people back in as well to do the collaboration, to do the teamwork. That is equally important.
It's a difficult one, isn't it? We've
Yes.
been looking for new staff, and it's one of the first things they ask. You know, how often do I have to come in? Especially here, though. I mean, you know, anyway. This is the last one from me. You'll be very pleased to hear.
Assembly Member Hall. I'm just going to bring in Assembly Member
Oh,
Default
sorry,
quickly.
then.
So how have we arrived at this 40% figure? Shouldn't it be something like 60%, the other way round, rather than 40-60 in terms of that? I'm a bit of a traditionalist, but I'm also a modernist, and I'm up for change, and I recognise in terms of behaviours and all the rest of it. But it does seem that 40% figure seems slightly odd. So have you arrived at this 40% figure of those that should be in the workplace rather than...
It's a good question, Assembly Member Deval. But in stages is the answer. So we started actually with something much looser, where I think, like a lot of big organisations, we were struggling to understand how we were going to achieve that balance, because it was a very new way of working. So to begin with, we delegated authority to department heads with no boundaries, really, to work out how it would work for them, because different teams have to deliver in different ways. You know, obviously we've got teams that have to be in work every day, will always have to be in work every day, whether they're in our warehouse or whether they're out on a fire station in East London. And then there are others in IT, you know, doing remote programming, for example, who might need less. So arriving at a consistent model for LFB was quite challenging. So to begin with, we gave people a lot of licence. That didn't work for us, I'll be honest with this committee. We didn't see the levels of attendance, the balance we needed. So what we've done is brought in a figure that we think fairly represents across the different groups that balance of kind of attendance and remote working. But my expectation as Commissioner is that there are definitely teams where I would expect it to be beyond the 40% internal teams who can remote work. So I don't think it's going to be the same for everyone. That's our baseline minimum. And what I would say is it's under review. If this doesn't work for us, you know, bearing in mind everything we're talking about is this enormous kind of challenging programme of change that, let's be frank, is working in some areas, is not progressing as quickly as I'd like in others, I'm going to have to judge it on the results. So this is a policy that is under almost continuous review, and if it doesn't work for us, we would have necessarily, you know, have to increase that percentage, because I do need people working together to deliver what I think is the most challenging programme of change probably in the post-war period for the brigade. So I think it's a very apt question.
But isn't one of the issues for managers is that in those areas that are able to operate this policy, and you've recognised that not everyone can, do you know what I mean, in that sense, that you need to have some consistency across the organisation around that actually you start looking over your shoulder and seeing what goes on in another area or another section and think, hold on, how comes they're working like that and I'm working like this? If managers are exercising the right, maybe staff, or maybe come to a joint agreement around that, different policies in different parts of your organisation. Does that not breed to resentment in some ways?
I think that's why we've set the baseline where it is, to give people some room. But I think it's a very fair challenge, and we will have to see how it works in operation, because like a lot of organisations, I think we're grappling, coming out at the end of COVID, of what the new working environment looks like. So I think my promise to the committee is it's not set in stone, and I wouldn't seek to justify it on the basis of kind of science. You know, what we have done is benchmarks ourselves against a lot of other organisations, and I think we're going to have to see how it goes, because the challenges you talk of are real and could present an issue for us.
No one around this table will suggest people are, you know, sort of not doing the performance or the productivity, but there is evidence that suggests that people in the workplace coming together, working collaborative, doing some of that joint work, increases productivity, not in isolation. There are times when you need to work and you need space, and I recognise that, but also about the younger generation. But you know, some of that younger generation, dare I say it, needs to understand about organisational needs. It's a two-way issue. Yes, we want to help them, but also they're part of a wider organisation about work, isn't it? And that's what you need to foster in your organisation around that, isn't it? It's not one of individualism.
No, we're very much a team-based.
Team.
I mean, the team is everything to LFB. No, I hear your challenge, and I think we all have to come back and explain how it's working. And again, how I will judge it is in the outcome. It's less in the day-to-day. It's whether we actually get the change I'm promising, which isn't here yet. I won't pretend that. And I get to see the outcome. And if we don't deliver the outcome, I think that, along with many other things, we will once again have to go back to. I think one of the things we learnt out of Grenfell is that nothing stands still. The brigade was a place where things had stood still. You know, my view on everything you've heard today is, this is all good. This is a good start. We're making progress. Things are in place. But if we think we've got the answers, we're kidding ourselves, because we're a big, complex organisation, you know, serving this incredible city. It's got to change all the time. We've got to get in the habit of continuous improvement, continuously learning, listening, recognising when we get things wrong, and having the courage to stop, admit we made a mistake, do something different. I think our people are beginning to get the idea of that, but again, that's a cultural issue. It's going to take time for people to accept that continuous change, continuous improvement is also part of a modern organisation.
Thank you. Assembly Member Bailey.
Sorry, not to labour the point, but you yourself said that when you gave it to individual teams, they all work individually. Some teams have no choice but to be there. So wouldn't it have been better to set the target higher, so you'd be able to give back to those teams, rather than now you're going to have to go and make a culture change that some teams will find very painful, remembering that the history of the brigade has been culture change has been very hard. So why have you said it's so low at 40%? Because that just seems like you may have to go back to other teams and say, actually, we're going to have to up you to 60% or whatever percent.
Yeah, I think that's a fair question. So we set it really in consultation across the organisation. So we didn't come up with that kind of figure in isolation as senior management. We worked across the representative bodies. We worked with individual staff groups. We held a lot of conversations with department heads to try and find a balance to pitch that point. And I think, to be fair, we have to see whether it works. What we have told colleagues is that if it doesn't, we'll be coming back. So we've already set that expectation. We haven't said this is it. We've said, OK, this is your baseline. We expect to see this as a minimum, and we will judge you on your outcomes. And if it doesn't work, we're coming back to change. But it was driven by very strong opinions inside the organisation as well, what teams thought had worked really well through COVID. So I've got to offer that balance as well, is that there were a lot of places which showed, absolutely accepting your point, Assembly Member Duval, that productivity and collaboration is driven by teams working well together. We do have evidence as well that shows productivity went up in other areas where people work remotely. So I think it's just that balance. But again, I think we're all big organisations are in a place at the moment where they're struggling with this and they haven't necessarily got the right answer. We're no different, and we will have to come back and justify ourselves to this committee and others.
How much did you and your management, right up and down your scales, take into account that you're a publicly funded body? There's people sat at home now. We don't care what Deloitte does. That's Deloitte's money, but we do care what the LFB does. How much was that taken into account? Because as a taxpayer, if I think people are attending work 40% of the time, I think I might have something to say about that.
I mean, what I'd say to that is they are working the other 60%, but they're working in another location. And actually, one of the things I would say about finance is that hybrid working has given us an opportunity to claw a lot of money back into the brigade. Because, of course, we've shared our space with colleagues such as the GLA, other functional bodies, and we've opened our headquarters up and brought in a lot of revenue back in. And to be frank, I anticipate that continuing in the future. You know, we've diversified the way we've used our estate. So in many ways, it's offered us opportunity as well to generate income. So I accept what you're saying. We've got to justify that in the context of the public purse. But actually, one of the things that helped us in terms of that finance was hybrid working.
Okay, thank you, Chair. Thank you.
Assembly Member Hall, I'm just conscious of time, so if you...
Well, I'll just ask it very, very quickly and ask for a quick answer. How will LFB's new HR business partner model better support the mental health and well-being of staff? Briefly.
I touched on it earlier. It's essentially around being able to provide senior HR professional support as a strategic partner to our senior leaders to help them design strategies to improve how they lead their people and help them get the best from their people. So the example of sick absence, targeted strategies to reduce sick absence. It could also be supporting them through better organisational design of their teams to get better outcomes from their people. It could be through interventions around culture change, where you identify through lots of different qualitative and quantitative information that there's a cause for concern, perhaps, working with them on some targeted strategies.
Lovely. Thank you very much. Thank you, Chair.
Thank you very much. Assembly Member Bakari.
Thank you. I just want to say, Kate, I've been really impressed with the way you've been answering the questions, and you are fully briefed in your area. So I just wanted to just say that, you know, that I'm really, so far, the answers that we've been getting from you have been excellent. Thank you very much. I just wanted to touch on something that you said earlier about the mental health webinars that Assembly Hall was concerned about. I presume that all mental health awareness training is provided on webinars. Is that correct? Or is it more to it than that?
So some is provided online. So we have our mandatory online e-learning package, which is around mental health awareness. Then our webinars are not mandatory, they're optional. People can dip into different topics that they're interested in. They're all online. And then we also have our face-to-face recognising stress, anxiety and depression training. So it's a mixture, depending on them.
And yet there has been, from reading between the lines, a poor uptake it has to be a voluntary uptake, doesn't it, at the moment? Would the LFB consider, after looking at the details, and I know you're going to look into this in terms of numbers, would you consider making the training mandatory?
It is mandatory.
Yeah,
so
it is mandatory.
The webinars are kind of an additional layer of training and development that people can dip into. But at a base level, the computer-based training package is mandatory for all leaders, and the face-to-face training that Kate is referring to is also mandatory.
Excellent.
We're in a place where that has to be, and actually we've got an ambition, really, that we put a different model in place, particularly across the fire station estate, where we've got 400 dispersed teams, where you have a mental health first aider with trauma awareness on every single watch. So that's the model we're moving towards. But again, that will not be achieved in 6 months, a year. That will take time because of the size of the workforce to roll out.
Excellent, thank you, and thanks for that clarification. Now, you did mention the health and well-being policy earlier, and you've given us an update. If you wish to add anything more, please do. But Commissioner as well, if you can come into this, how will the trauma support initiative work? And you mentioned peer trauma supporters specifically work alongside the current counselling offer that you provide.
Well, there's lots of other models in other emergency services and the military in particular, actually, which shows that, and I've got experience of this as a first responder, is that where you get your biggest bang for your buck after a really traumatic incident is in the conversations you have with your peers immediately, decompressing. What that model does is it doesn't take the place of professional therapy, but it allows people who are informed and can understand how those conversations should be best framed to identify risk to the individual primarily, and then say the right things, frankly, to support them at that point. So it can never replace professional therapy, which is after years of training, and we're not looking at it as a lever to then reduce that support. This is in addition, based on best practice in other trauma-facing sectors. So what we've tried to do is look across military, policing, other emergency services, NHS, to pull out examples of best practice in terms of peer support and then apply it to the brigade. So it's complementary to, and all the evidence shows the right way to deliver kind of an improved landscape for trauma support.
Brilliant, and thank you for that answer. So how will you measure the effectiveness generally, but also specifically on the mental health first aid trainers in supporting the staff?
I think we have to look at baseline data. I mean, so again, I don't think it's going to come down quickly, because you have to recognise that we don't exist in isolation. We exist in wider society where there's now a far greater understanding of mental health, which is a good thing. But where actually pressures on people's mental health are increasing. So if you look at cost of living, if you look at actually, let's be honest, the pace of change we're bringing in the brigade brings its own pressure. Actually, the shadow of Grenfell, which still lies across the organisation, you know, we had a very severe cultural and kind of organisational shock there. These are all things that contribute, I think, to people's poor mental health. So it's not that we're immune to those pressures that will continue and perhaps grow, but I would expect to see, you know, more positive early intervention, a quicker kind of resolution to mental health issues. I'd like to see that in the figures. So I think, again, we've always got to judge things on tangible outcome, not the words I speak in this committee. We've got to come to you with evidence at the other end.
It's really great that you're saying that, and I hope that I'd see more of that in other committees that I've been on. But I have to say, Andy, I'm really impressed with that answer. So thank you very much. There's also been an obviously sad result of the reason we're looking into mental health is because of the suicide rates that we've had in the LFB. And one of the outcomes of the LFB's involvement in the Asian Fire Service Associations project was looking into suicide in the blue light sector. Can you tell us a little bit more about that?
Kate, you able to? Thank you.
Sure. So we haven't had the outcomes yet, but we should do in the next couple of weeks. That piece of work is looking at the prevalence of suicide amongst fire and rescue services nationally, and then looking at what kind of long-term resilience programs we could put in place. But once we get that information once we get the outcome of that work and how we're going to take it forward, then we're happy to share it with the committee.
Brilliant, thank you. My last question is, have you reached a decision on whether the LFB should undertake its own project looking into suicide?
So we're looking at that alongside the work with AFSA. So once that concludes, we'll then take a final decision as to whether or not we go ahead working with the Royal Foundation.
Could I come in briefly? Because obviously every single death by suicide is tragic, but I think that the LFB is part of a sector where mental health has been a problem for some time. So the AFSA work is really useful, and the brigade will build on that. But I have spoken to the HMIC FRS about whether they would look at fire service approaches to suicide and suicide prevention as part of their inspection regime. Currently they don't. They look at sort of broader well-being and sort of people, but they haven't yet looked at what the statistics are, what the measures in place are. And I think the more we can do that, we understand what the pressures are on the whole sector, the better. And I'm due to have a follow-up conversation with somebody who works for the HMIC FRS about that, and hopefully just sort of prompt them. Andy's mentioned how helpful their work is. It's not always sort of welcome comments in terms of they come with difficult truths, but actually they've got such an important role in terms of bridging the whole sector with a with the remit of having a critical eye on what happens. So I would hope that we would also see them pick up some of this this work as well.
Thank you, Deputy Mayor. It's really good to see that you're giving that level of scrutiny over this as well. Appreciate that. Thank you.
Thank you for that. It's reassuring to hear that you are treating it with the importance that's clearly necessary. We're going to move on to Lfb Outreach and Engagement. First questions are going to be asked by Assemblymember Bailey.
Morning again to our guests. I'm going to address this first question to the Deputy Mayor. How are you working with the brigade to improve engagement with and recruitment from different communities across London, particularly those that are underrepresented in the LFB?
Thank you. I'm going to start by thanking Assemblymember Bakari, because I think you've been out with the brigade on some of the outreach work, and I think it's really welcome. I was delighted to hear that, so thank you very much for doing that. I think that the outreach and engagement has to go back to 2 steps. So you can't just invite people to apply and say we want to have underrepresented groups. Over the last few years, there's been some really interesting research by the Brigade, it's probably some years ago now, on what the barriers were to women and Black and Asian communities in terms of applying to become firefighters or to entering the workforce. So I think the work within, I'm going to give a plug to the Community Risk Management Plan, which is going to be published for consultation next week, and say that the idea within that is that the brigade becomes much more open, that you don't just have a building in a community, but the fire service becomes a much more obvious open part of the community. So it's not just a building people think, well, somebody will come and sort of put out a fire if they come there, but they actually feel much more like part of the community. So we're hoping that the next strategy, which I think is going to be called, I'm going to do some sort of breaking embargoes potentially, but it's going to be very much focused on it being the fire brigade for London. We've also done quite a lot of work. Various people within the Mayor's office have supported the work that the brigade has done, led by the Commissioner, in terms of engagement with the communities around Grenfell. And I think that rebuilding of trust with communities is an essential part of this work. So, but I think that the work coming through the Community Risk Management Plan will be key to sort of taking it to that next step.
Okay.
I'm hoping, Kate, you've got the actual figures, but we have over the past sort of 2 years, one of the areas I would say we have been successful in is changing the numbers in terms of who we bring in terms of a very much more diverse intake. Yeah. That's obviously generational. So, you know, it's going to take time for that to bleed all the way through, but percentage figures are much higher. So if you could pull them up, Kate, in terms of percentage figures for women and black colleagues particularly. I know that we've significantly improved that in terms of our recruitment.
While Kate looks at those figures, back to Deputy Mayor, how was this work being done? Because you outlined almost the goals and what you'd like to achieve. Give us an example of where this work is where new bits of work have been done. Like in our notes here, there's a project that happened in Kensington and Chelsea, which I'm particularly interested in. I came from Kensington and Chelsea, and I feel like our fire station had always been part of the community. And so what bits of work are being done?
Yes, so it varies from station to station. I will bring the Commissioner in to answer this, because obviously I don't have that engagement with all the stations. What I have done is speak to the you've got a new outreach manager who's probably been in post, he's not so new anymore. Community engagement manager, who's actually set up projects to sort of help fire stations understand how to do that community outreach. So my part of the jigsaw is scrutiny of the work that's being carried out. So talking to Andy, talking to the individuals, going out on fire stations and understanding what they're doing in terms of community outreach. But I think that one of the lessons we learned was that if you cut the professionals, and we had to make very difficult cuts a number of years ago, some of the cuts that we felt were easier, sort of more palatable cuts, were actually to some of that community outreach, the recruitment teams, and it's taken some time to rebuild that up. But I think for me, one of the difficult lessons I had to take on board was actually some of the things that you feel, well, you can cut that more easily than other bits. Actually, you lose something when you cut some of the teams that were supporting the work on fire stations. That sort of very face to face. The first stage of people understanding how to do that is somebody talking them through how they can better approach.
You retreat to your statutory role. Obviously, you have statutory roles, and that's your base work, and you sort of retreat to there.
Assemblymember Rogers.
Not quite. That wasn't quite what I said, but I'll hand over to the Commissioner. Thank you.
I think we can give you concrete examples. So, actually, the cultural change team inside Kate's area of business is an example of wanting to understand your communities and then driving strategy that then means you get out and meet those communities. The establishment of a a community engagement team led by a professional who'd come from another organisation with a lot of experience. This is Donna Peters, who are doing the hard miles in communities who actually didn't want to speak to the organisation. So Donna has been out there building those networks across groups that we don't always often talk to. For example, travellers in Southwark, some of the Muslim communities in London who felt very traumatised after Grenfell. It felt for them like a particularly Muslim tragedy, actually. You know, those are difficult conversations. We've run 9 very serious, large-scale engagement exercises across pilot boroughs to completely change our approach to this. So this is community forums, bringing the community in for them to tell us how we should be doing our business and opening ourselves up in those boroughs. We've seen good results from them. The review of that is being written up, and I expect that to expand across the brigade. The re-establishment of an outreach team. You know, when I took over, we didn't have a fully established and staffed outreach team. You cannot change your figures in terms of diverse recruitment unless you've got people going into the very communities where you want to recruit from. So that has happened, and we've seen the results of it. And more importantly, that community engagement team works hand in hand with the outreach team. We're in a place now where I think we're going to bring all our community practice together. We're thinking about it at the moment. So we moved from a place which has always been traditional public service community advice to one where we kind of drive a much more engaged kind of approach. But that's real on the ground. That means forums. It means, for example, after New Providence Wolf, we were on the ground with community engagement specialists, not doing perhaps what we've done in the past, which is what we call a hot strike, handing out leaflets, putting up smoke alarms, but actually setting up a forum where really angry leaseholders sat in a room with us and basically told us how unhappy they were. Now, that is not an approach the London Fire Brigade's taken before, but we are committed, because I am committed to doing the hard miles, because I've learnt that since Grenfell. You don't step out of a community space when it's difficult, you step into it. We're going to do the same with disabled rights around PEEPs, which is going to be a very difficult area of analysis, and I expect to bring back to this committee. But we will do the hard miles by sitting with disabled residents in London and listening what they need and want.
Okay. Shall I continue, or do you going to bring?
I'm going to bring in Assemblymember Rogers. Thank you.
Thanks, Chair. Just a quick question to Andy. I'm casting my mind back to a previous FREP meeting. I think it was at Old City Hall, and I had an exchange with Fiona Dolman around recruitment. And my understanding is that you track and report on recruitment of women and recruitment of people from BAME communities into the brigade, but that you track but don't report on LGBT recruitment. And I challenged Fiona about that, and I asked whether you could start to report on recruitment from LGBT communities. And I just wondered whether
I remember that, and that was a fair challenge. So please, Kate.
Thank you. A really fair challenge. So we do track that. We track for sexual orientation and disability, and we do report it through our quarterly performance report for People's Services, which goes up through to the Deputy Mayor's Fire and Resilience Board, and therefore we report it in that way. But we can look at how we report that externally, perhaps as part of the CRMP.
So we gather the data. We gather the data. I would expect to bring it to this committee and to publicise.
And I think that the metrics, there'll be consultation not just on the strategy but on the metrics. So as part of that consultation, we can make sure that there's robust metrics in place for that.
Thank you. I think it's important, given some of the brigade's recent history. I think if we're talking about recruitment from diverse communities, we absolutely have to be including the LGBT community in that.
We agree.
Thank you, Chair.
Assemblymember Bailey.
Thank you. Can I just quickly ask a question about your cadets? Is how alive and kicking is that?
Alive and kicking. So I think one of the very significant successes in COVID was we expanded from about 15 boroughs to all 33. So we've got a cadet unit in every borough now.
Okay.
We've revised and brought forward a new policy in terms of youth work, where we kind of rationalised and focused our efforts in there, because our experience of cadets is there. Our premier recruitment tool in many ways. Mm-hmm. They're an extremely diverse body of young people that genuinely represent London, from all backgrounds and demographics. So it's very important for us to expand it. Really grateful to the Mayor for funding that expansion, and we'll build on that. So it sits at the very heart of our youth provision.
Okay, I am a cadet, so I'm very happy to hear all of that. Is there any particular demographic that's a challenge to reach, both from a community point of view, and also you talked about some of the difficult conversations you've had to have with the Muslim community. You've also talked about some of the successes you've had in diversifying your intake. But is there any particular communities that are still proving to be a challenge?
I think we'd have to come back to you with that detail, because I think it's a really good question, and I would want to know whether we have gathered that data in that way. I would expect us to. I would have thought Donna Peters will have a sense of who we're struggling to reach in terms of wider community engagement. In terms of cadets and reach, I don't know whether we've done that depth of analysis, but we probably should. But we can find out. What I would say is I don't think there's any one group. I think where I would take us is that, again, for all the good work that's been done, we're at the beginning of a different approach. Too often for me, our fire stations, once you get into them, they're great places. You know, many of you have visited fire stations. You went to Paddington recently. It's a great place. But they're quite foreboding to local populations. They've got barbed wire on the walls, big red doors. You know, they're a challenge to get into. So I still think there's an element of us needing to open up in totality, and that for all sorts of different communities, there's still that barrier. Not because we can't work effectively, but simply because we're not seen enough and we're not understood enough. So rather than say there's any one particular community, I think it's on us, particularly as part of the new CRMP, which is, you know, your London Fire Brigade is what we're calling it, is to get out there and proactively seek people out. Not to not sit on our stations waiting for people to come, but to proactively get. Now, good stations are doing that anyway. We just need to give them the power to do more of it.
Yeah, I suppose as a committee we'll look forward to the strategy. And I have to say, the fire station in Ladbroke Grove has always been a very big community hub.
North Kent's an exemplar.
Yeah, and I think actually it's because they keep the doors open.
Yeah.
They very regularly would just keep the doors open, and you'd walk past and eventually you would see a firefighter and they look like normal people, and there the conversation would start. But, back to you, Chair. Thank you.
Thank you, Assemblymember Bailey. Assemblymember Bakari.
Yeah, I'm happy to ask the question C then. Is that if that's...
I didn't. I felt like
that's fine. I'm happy to do that. It's a good question. Yeah. One of the things I'm actually really passionate about is the engagement that you've started with the Muslim community. I'd like to know a little bit more about that, but also about other religious communities as well.
Yes, please.
Yeah. So the faith communities of London are a very important set of stakeholders for us. I mean, again, if I reflect on my own personal experience, I think one of the most moving aspects of what was at times a very poorly handled aftermath of Grenfell, if you think about the institutions involved and the findings of the inquiry, what we're seeing was the power of the faith community in bringing people together across disparate groups, leaning in. So we know the power that faith holds in communities in London, and we work across all of them. So I can give you direct examples. We work very closely with the Orthodox Jewish community in North London, for example, up in Stamford Hill. We've got very good links with them, have for many years. I would expect my borough commander there to have a direct link with the faith leaders in that community, to meet them regularly and to invite them onto our stations and to recognise their own moments in a year of celebration, which quite often are important for us to support. If I go down into West London, you have very significant Sikh and Hindu communities centred around Southall and Brent. Again, we have an awful lot to do with them. We both support the major significant kind of faith celebrations through the year, whether that's joining in parades or making sure that they're safe when they're conducted. And then if I think about East London more recently, you know, we've recently built some, you know, and I'll thank you for your help, really built some good links there, I think, with Donna leading on a very useful set of conversations with East London Muslim people. And then if I think about my own experience, I was down on the Al-Manar Mosque for the iftar following the kind of 5th anniversary within the lunar calendar of Grenfell, which was actually not a place we would have been invited in 2 years ago. We simply would not have been there. And I recognise it's the hard miles done by good people at North Kensington Fire Station and Donna and her team that allows me the privilege to sit there with the bereaved and survivors. So we can see the beginnings of where we need to go. I guess with everything I talk about today, nothing can be seen as task and finish. One of the most painful parts of the Grenfell inquiry for me was listening to what happened post-Lacanau, where there was so much energy and endeavour to make the changes that were needed at that point, but then something happened. This all has to be sustained. We can't pat ourselves on the back. This has got to be how we do our business moving forward forever. So I think that's my view of it, is that it's a good start, like everything else, but it's got to be grown, it's got to be sustained.
Thank you. Thank you so much for taking that time to listen specifically to the Muslim community, because Grenfell, I perceive it as a Muslim tragedy, because a lot of the people affected were from the Muslim community, and it happened during the month of Ramadan, and it happened when many of the Muslims were waking up early. I get emotional just talking about it, because people were getting up to pray, and it was a very difficult time for me, because I was hearing a lot of friends who were there who were dealing with it. So yeah, really pleased that you're doing this work. And I'm composing myself. One of the challenges I gave you my very first meeting was when are we going to first, meet the first hijabi Muslim firefighter? And I'd love to know your progress in that particular area too.
Do you know what? I haven't got the answer to that. I would hope somewhere in our recruitment figures there are people who feel confident enough to join the London Fire Brigade wearing a hijab.
Yeah, yeah.
I mean, what I would say is I do want to get the breakdown of Black, Asian, minority, ethnic, so that I can tell you in more detail. But as of this quarter, we're now at 46.9% of our firefighter trainees being from a Black or Asian minority ethnic background, which is huge progress considering we were at 10% in March 2019. And I think we're incredibly proud to be leading the way really nationally, I think, compared to a lot of other fire and rescue services. And I hope that we will have, we do have a real variety of different backgrounds within that unfortunately termed group, which I know we should stop using.
Brilliant. There's a project called, a campaign that you've titled You Can, which is supposed to attract the Black and Asian ethnic minorities. Can you just give me a little bit of update on that?
Yeah, so this was a social media campaign that was targeted specifically at Black women, which is an area we have struggled to reach, I suppose, in our recruitment. So it was targeted on different social media, TikTok, Facebook, etc. So the general public wouldn't have seen it. It's very much targeted to those groups. And that has resulted in an increase in the numbers coming through. However, we still see that the outreach work is the most impactful. The face-to-face engagement with communities, that's what makes the biggest impact. We will continue to do these kinds of social media campaigns, but they just don't have the same impact, if I'm honest, as the great outreach work which you can see in the data.
Happy to. I'm going to be just very quick last question about the cadets that Assembly Member Bailey mentioned. There actually has been a reduction, the data that you've shown us. 62% of LFB cadets were female in the 2018 and 2019, but it did drop quite significantly to 38% who were female in 2021. I have raised this before, but it would be really good to raise this again and see an increase of those female cadets as soon as possible, and also to make it a long-term aim.
I think we need to go and look at that. I'll be honest with you, I hadn't picked up on that figure, so I think that's something we'll take away and look at, because that's something that would concern me, because that doesn't feel like we're doing the right thing in terms of attracting the broad spread of people you'd expect based on London's population.
Yeah, and with apologies, Chair, I just want to come back in, listening to the dialogue about outreach. I just wanted to say this is why the culture review and culture change is so important, because all the effort that is being made to get people through the door, to get people to apply, to get them in as our trainee firefighters, our firefighters on development, in the in Union Street, in all the teams, inspection teams and so forth, it will be worth nothing and almost counterproductive if we don't get the culture right when they're actually there. Yep. So this is why the work Kate and her team do and the work the outreach team do on recruitment has to be tied in with the wider piece of work on culture, because otherwise it could actually be counterproductive and lead to problems longer term trying to recruit people and get the diverse and inclusive workforce that we're looking for. Thank you, Chair.
Thank you. Assembly Member Duval.
And that's why your community risk management plan is so important. You alluded to that, and really we should be making much more of that. And I recognise some of the words in terms of the Commissioner said about to grow and sustain, because I think if you look at some of the criticisms of the service in the past, and particularly I'm going way back, but sea changes, it's been too bitty about some of the issues of how we've tackled it. So recruitment drives out, outreach to reach out to other communities is fine, but is it just for Christmas? It's a sustainable process. But actually, it's not just about recruitment drives and changing the nature of the service to reflect Londoners. It's also about the risk issues and that outreach to other communities. Also saying, look, we're here as a public service and we're right to say that, but also to explain some of the risks that all people face in terms of driving it down. So I just want to raise this, Chair, that we should formally sort of receive this briefing note that we had to make that public, because there's some good information here about some of the progress that you're seeking to make before you embark on the final stage of the consultation. You rightly throw down a challenge for FREP members of this committee. I rightly say, Chair, that we might want to explore, it's not just FREP members, but other members of the Assembly to be involved in that final stage. And you might want to think about how that could be. So whether we use constituency or list members of the Assembly just to do that further push in this final piece of work and just raise it to another level. I really am seeing where the gaps are of the good work that you've already done, because it's a very good briefing note. I commend it. Could you also supply to the committee the consultation materials that you're using? I've not seen them, so I wouldn't mind having a look at some of those. It's alluded to in the briefing note.
Yeah, so they're due out on the 30th of May, Monday, which we will meet that deadline. At that point, obviously, we want the widest possible engagement, and you are very, very important stakeholders in that. They will be made immediately available to you.
It's got me thinking of what I do, not just a new member of this committee, but also in my constituency of Greenwich and Lewisham, and thinking where that is. And obviously, I will be talking to you, but I think we need a coordinated response on our side, either a committee response or from the London Assembly, of how we involve other colleagues. The 25 members of the Assembly will be interested in this work, or they should be interested in this work. I hope they would.
It is the major strategy for the brigade over the next few years, so I think we'd be very keen both to engage with the committee but also to engage with the full Assembly. So whatever approach you would find most helpful, we're open to discussing and sort of facilitating.
We might want to take some more advice from you about where you think it is and where you think those energies are best directed, and then we need to think about what we can do within the time frame that we're doing now, Chair. Okay, thank you very much for that. Let's then move on, and thank you for that briefing note. It came in just before the meeting, but it was very good, and we've not all had a chance to digest it. That's why some people are looking, hold on, what's that? Do you know what I mean? But it's very welcomed and good starting point to do some work on. Okay, let's look at some of the other groups that we've got. So in Q3 in 2021-22 performance report advises that the desktop audits of care homes could be a focus of Q4. So how many audits have we undertaken, and is the target now being reached?
This year, so in 2021 was notably higher in this year due to the lockdown being in place previously and the inability to attend any audits in person. It is a useful way of triaging cases and determining whether a further in-person visit is required, so we like it. The most recent visits for Q4 were higher than in Q3, which was affected by in-person audits being progressively reintroduced, but they're not high enough yet. So we're on a trajectory of improvement coming out the back end of COVID. So if I look at 2020-21, which was just before we started to go into full lockdown, we're at 59. Q4 now, 2021-22, we're looking at 28. So I need to see that figure go back up. There is a balance here, though, as well, because what I would say is that we're facing a pressure post-Grenfell, and I am about to discuss this with both the Inspectorate and DLUC around how we manage risk in London. So if I look at Liverpool, Liverpool's got, if we look at their risk-based inspection programme, of which care homes will fall part of that risk-based inspection programme, they've got 900. I've got over 20,000 on the list. In the middle of COVID, and we did explain this to central government, that if they wanted us to do it, we supported it. There would be a knock-on to other buildings of risk. They wanted us to look at all 8,500 of our high-rises. We did that in person. But obviously, as part of that, building risk review, very important. We would not want to do it. Other things have slipped. So I think we're fighting a continual kind of battle to balance where we put what is a relatively small group of very, professional people to look at the most difficult and high-risk buildings. I'm not sure we've got the balance entirely right. We need to talk to central government and the inspectorate about aligning what they both want, because each has slightly different views. And then I think, again, going back to the CRMP, our CRMP has got to be very, very clear about what our offer is in a city that tops the Global City Index, is one of the most densely populated in the world. 10 million here. There's only 4 million people in Los Angeles. You sometimes forget the scale of London. We're completely different to the rest of the country.
But isn't there some other creative solutions, because arising out of COVID and some of that work, and we're talking about a desktop evaluation of that, and yes, there's a degree of expertise, but we do have, London boroughs there doing certain work. Is there not a way that we can triage a little bit more about that priorities? So we have safeguarding boards, which your organisation is represented on, and somehow those authorities stepped up during COVID to do their bit. Is there not a way that we could try and eat into that? Because I think we'll always be playing catch up. There always will be a priority on that small cadre of people that you've got to do it and you've got to concentrate on. But equally, it's going to be the one that we miss, isn't it?
Yeah.
That could be the disaster. So how do we minimise that risk for this group, vulnerable group of people, and recognising that we've got public sector, private sector providers around that? Each have got some schemes. Can there be some adaptation of your inspecting programme and their inspection programme? Because some will have an idea of where priorities might be and how they coalesce. Is there not a case to doing something special about this group of care homes to just move it a little bit further? It's not perfect, but as you said, no one's got the number you've got. You ain't going to be able to do X, Y, Z, but we want to try and minimise the risk to this group and this group of homes as far as possible.
I think the answer is yes. So one of the things I think that we will face some criticism about in inspection is how effectively, despite the very excellent skills those professionals have, how well we collaborate across local authority and other partnerships. So I think we could improve there. So I do think that there needs to be smarter ways of working in approaching that risk in a joint environment. My caveat on that is that there isn't the skills beyond the brigade. The wider experience and kind of technical skills required to really understand fire safety is distinct even from kind of generalised building safety. So there's something about how far they can support us. But I think your challenge is right, because there's definitely a triage process in there. I hope part of it long term will be addressed by the fact that, again, one of the most significant changes we've brought as a result of Grenfell is obviously we've trained all our fire station staff. It was always seemed ludicrous to me that we'd let that go kind of 20 years ago with the coming of the regulatory reform order, that we stopped our fire stations going out and providing regulatory fire safety advice. Again, we're in the early stages, so we're out there doing fire safety advice now in businesses and care homes. We're going to need to rebuild the competency and skills in that part of our workforce. Again, I think that'll take a couple of years, but I want to get to a place where we see station officers on stations undertaking kind of regulatory enforcement at the lower level. It's just going to take us a bit of time to get there. So I think you're right to challenge us. We need to think more imaginatively across the partnership piece. I think that is actually a vulnerability we need to look at directly, and we'll take that away. And then I think we need to come back to explain to you how we make best use of the resources we've got to expand our skills to hit as many of these buildings as possible. But it's a live debate, how you balance that kind of focus on different areas of risk. Because if you're living in a high-rise, you don't want us to turn away from that.
Yeah, I mean, in terms of just moving it away, but some of that won't be about high-rise in terms of care homes. That's the immediate one because of experience says that. But some of this, and it's desktop, actually there's some ownership that others, the owners and providers, the shareholders have got to take some responsibility. We can help them and they can help us. It's that partnership working that I'm trying to do about eating into the numbers a bit more. But I think you've taken it on board. Chair, at this stage, I think I'm passing to one of my colleagues to give you a break.
Can I just add something? Because I think it was a really good point, is that obviously one of the big hooks for this in terms of responding to, I think, the kind of point you've made, is, of course, we've got now the new fire safety order, which gives us expanded kind of enforcement powers around some of the things we picked up from Grenfell. And I think more importantly, in terms of the collaboration piece, we've got a building safety bill going through Parliament as we speak, which again should give us greater opportunity to collaborate with the new regulator. I think there are questions about that regulator, about its potential effectiveness. I have some concerns as London Fire Commissioner about the level of both funding and competency within the proposed new regulator that we will need to unpick. But in principle, it's a very good thing and should drive the cooperation I think you're asking for, Assembly Member Duval.
Okay, Chair, I need to hand over to my colleague who's going to take the next question and comes back to me then.
Go ahead, Assemblymember Blansky.
Thank you very much, Chair, and good morning all. Thank you for your answers so far. Commissioner, we've spoken quite a lot over the last year, particularly around flooding risks and the fact that the London Fire Brigade don't just deal with fires and deal with lots of other things too. What work is being done to inform and educate Londoners and particularly businesses? Because as we've had this discussion, we know that a lot of people think it's just not going to happen to them, or they're not ready for kind of a sustained rainfall that could happen overnight that they might not be ready for.
So I think we need to start with the CRMP. So the risk of climate change to London is central both to our own analysis of change in risk, but also from the first round of consultation, what Londoners have told us. So it forms a central part of that draft strategy, as in how we are going to respond. So we see it, along with the high-rise environment, the built environment in London and terrorism, as one of the three primary kind of risk factors we need to adapt and provide greater resource against. Where does that take us? Well, we're better equipped to handle flooding events than we were perhaps back in 2018-19, because all pumping appliances carry life jackets as well as throw lines now, inflatable hose kits for reaching people in water. We've got 10 specialist water rescue teams equipped with inflatable boats, engines, dry suits, inflatable rescue pass. We've got national flood rescue advisors in our officer cadre. So in terms of our immediate response, we're well prepared, but I do think that will need to continue to evolve if we start to see repeated episodes of the sort of pressure we saw last July. I mean, we took 5,000 calls on one afternoon in July 21, and we attended over 4,000 incidents across the course of that afternoon and evening, some of them life-threatening, people trapped in basements, people trapped in cars, rising tide. We're working with a number of local authorities to install throw-line boards in appropriate locations. So we've obviously got a lot of riparian boroughs where they feel the immediate impact of tidal flooding. And actually, this is an example of where I think we work really effectively in terms of coordinating communications with partners from across London. So we've done a lot of campaigning publicity around the dangers of cold water shock, what happens if you end up in the water. We've obviously got, and this is fairly niche, but it's important because it's publicised. We've obviously got an award-winning garden, Chelsea Flower Show, which is all about how you make gardens less prone to flooding, and don't tarmac your drive over and think about the risk to you of flooding, preparing households for flooding. So we're thinking about it across the piece, from campaigning to operational response to cooperation and collaboration. But again, we can't stand still. The CRMP has got to give us a direction of travel where we increase that, because actually, if I think about climate change, the two significant risks to London are dry summers and the challenges around infrastructure and grass fire in London, which in London could be really significant. If you get a big bit of open land like Wanstead Flats or the commons up at Greenwich going up on flames, they can burn for days. And, whilst those incidents in a rural environment could be very difficult, you don't tend to have the immediate impact on hundreds of thousands of residents, some of them with, breathing issues, for example. And then the other one is flooding, where we know we're going to see more of this.
Thank you. And just finally, briefly, the Deputy Mayor addressed at our last plenary on fire resilience and emergency planning that tarmacking and AstroTurf was a big issue around this, and you just mentioned going to Chelsea Flower Show. We know that often the people who feel the worst effects of climate change are the ones with the least economic resilience. What do you see it as the role of the Fire Brigade to get out there and talk about tarmacking and AstroTurfs, or what do you see your role being in that? Yes,
partly, because we're part of the wider kind of public partnership in London, because I know that if we talk about those things, then we see a reduction in pressure on our own services. There's a direct link from us going somewhere into a community saying, look, think about what you do to your front garden, because actually it may cause you real drama if we get some flooding, because you'll find that it's suddenly inside your house. Whereas if you do something different on your front drive, it actually won't be inside your house. The surface water drainage is likely to cope with it. You'll get a drain away, and actually we won't have to be coming in and helping you remove your possessions or even potentially save you, depending on where you live. So I think there's a direct link between widening our advice and campaigning, because we know that if we don't, in the end, you know, we're like all the emergency services. When things have gone wrong in terms of regulation, infrastructure, advice provided, we're at the base end of sweeping that up.
That's really good to hear. Thank you, Chair.
Really interesting, thank you. Assembly Member Duval.
So in terms of some of the emerging risks, is there any evidence of that you need to move into outreach and advice about new ways of people working more at home? We touched on it earlier on in terms of having an impact on the service.
Yes, and as part of our assessment of risk for the new CRMP, we've looked at that. How's the demographic changed in London? And it can shift really quickly, because obviously at one point we had everyone working at home, and we had to, for example, there was a directly linked campaign to that. We suddenly saw a spate of, and a very significant spate of fires on balconies. We had to put out a direct campaign to respond to the fact that people were working from home, people who didn't have gardens wanted to get out into the hot summer, started lighting barbecues on their balconies. If we think about how people travel to work, you know, we know there's an issue with battery storage on scooters because it's close to the ground, it gets knocked, it catches fire. We had to work with TfL to both educate and communicate, and then ask them not to enable that until we got a better assurance of safety of scooters on their network. So I think we're thinking very carefully about how people travel to work, what that does in terms of their safety, where they are, and how that's shifting all the time. And I think we've just got to become more agile at then shifting our campaigns to provide advice in response to what we sometimes see as a spike in incidents. So yes.
And on the evaluation of those campaigns, what do you think, is there any new way of working that we can to evaluate how successful you are in getting some of the points across?
I think that's a really good question. I suppose the most obvious one is that the balconies is a good example. Yeah. By working really well with local authorities to communicate that, we saw an absolutely massive drop in those fires. So I think, again, you know, without wanting to sound simplistic, the only real judge of whether your campaign's been effective is if we see an immediate reduction in the risk it relates to. But I think it's a question we'll take away, because I'm actually not entirely sure how we do analyse, certainly in terms of modern work, in the kind of digital analysis, the effectiveness and reach of those campaigns. We will be doing it, but we can bring that back to the committee.
Okay. And are you increased, I suppose one of the issues in terms of a sign of the times is the concern that many of us have around this table of the increase of fires as a result of rising energy costs, as in people thinking they use alternative fuels to heat their homes. And how do we get ahead of the game? We're in the summer now, and everyone's going to be in their
We've already started a communication campaign about, and I mean, this is really sad. I mean, I think this says something about both fuel poverty and kind of some of the desperate circumstances we find people living in London. We've had to explain to people that you really shouldn't cook over open fire or open gas burner in your living accommodation. So people are using camp stoves, people are lighting fires to cook. You know, which seems almost unbelievable to say to you. So we've had to genuinely campaign, because we've started to see a rise in incidents related to unsafe cooking as a result of fuel poverty. So I think we're very conscious that, like all emergency services, when you see large-scale pressure on society, you inevitably see the most vulnerable suffering, and you therefore see a knock-on into all sorts of incidents. You know, I'm sure at some point we'll get to trapped behind locked doors. But actually, again, you know, you think about how one thing links to another, which was Assembly Member Polanski's question. I know that if people find it more difficult to access healthcare because of a backlog post-COVID in the NHS system, I am going to see more elderly people collapsing at home, and there will be more need for our services to attend those incidents to provide access from other emergency services. So we're trying to think more and more in that way about understanding big society consequence and where it ends up with us in terms of a rise in risk or incidents.
Thank you.
Thank you, Andy. We have exactly 1 minute left in this section, and Assemblymember Hall has a very quick question.
Very quickly, do your borough commanders talk to the housing associations, etc., to ask them not to tell their tenants, etc., not to be lighting fires? Because I've known colleagues that have gone into people's houses where they're using the literally floorboards, etc.
They should be. I don't know if it's consistent enough. I think, again, that's part of the CRMP, is driving a consistent set of partners you must work with in a local borough. Because whilst we want to give agency back to borough commanders to assess and meet the risk in their own boroughs, accepting they're so different in London, actually, it doesn't matter whether you're in Tower Hamlets or you're out near Ruislip. Housing associations work across London. It's just how you engage with your particular one. So I think we've got to give people both more room to operate, but also clearer parameters about the people you really must speak to, because they're going to touch thousands of residents.
Okay, thank you. We're now going to move on to the final section, which is around performance, and we have Assemblymember Cooper joining us via Teams.
Thank you, Chair. Good morning, Commissioner. Sorry, I'm virtual. I've had COVID and taking recovery this week slowly, having plunged into everything on Monday, and then taking it a bit more slowly now. I just wanted to start by asking you about what, in your opinion, is driving the increase in bariatric incidents that the brigade is attending, and what impact is this having on the LFB?
I've got to be honest with you, I hadn't seen a significant enough uplift in that. So I think that's something you've picked up on usefully, and I will need to take it away, because that's not something I've got in the brief. I wasn't aware that we'd had that significant a shift in bariatric incidents, but it's a good question, and we'll take it away and we'll give you a proper answer. Apologies.
Okay, I mean, it's something I've picked up actually by visits to local stations, and have had some discussion about it. It'd be very helpful if you could come back to us on that. Thank you. My second question is about the increase in all special services weather-related flooding. What do you think is driving this increase? And again, what impact is this having on the LFB?
So the figures are skewed slightly, I think, because of that sort of major event last year, and obviously the way we measure instant data across a period of time. But it is climate change. So I was a National Flood Rescue Advisor. When I first started training as a National Flood Rescue Advisor, we used to talk about 100-year events, 200-year events, and you're talking to someone who went out to Cumbria to run the strategic response to the terrible flooding there. You know, I've been down to Somerset, to Surrey. I've run major flood incidents in London. We've gone from a place where you were having 100-year events to year-on-year events. Things that would have been considered 100-year events are now year-on-year events. That's data-driven evidence. You know, the Thames Barrier, I can't remember the exact figures, we can pull them, but I think it went up about sort of 7 or 8 times during the 90s. It goes up about 6 times a month now, I think. So, some of that is down to how they understand the best use of it. But I could give you lots of examples of how climate change is driving a different risk with flooding, and that's before you get to the built environment. You know, we are one of the most densely populated places on Earth. We like to concrete things over. That creates a very profound risk in terms of surface water flooding.
So it sounds very clear that you're saying it's a combination of the changes to the climate combined with our failure to properly implement over the years sustainable urban drainage systems, and so the combination of those sharp showers with the completely impermeable surfaces leads to surface water flooding as a result of the combination of those two things.
Yeah, I think that's a fair analysis of the situation, and that infrastructure that lies beneath the streets is very important to mitigating that safely. You know, we've got in parts ageing sewer and drainage systems, which I know, you know, colleagues in the water companies are working at a pace to try and resolve, but that is complex in London, again, because of the scale and the complexity, the subsurface activity.
Do you think there's enough collaboration between the local authorities and the water companies and the fire brigades, so that when we have these situations that arise, particularly under railway bridges. It's happened in Battersea on Queenstown Road in my constituency, and also in Rains Park under the railway bridge there. Do you think there's been sufficient collaboration to make sure that these events are minimised? You know, sometimes I've heard local authorities blaming the water companies for not keeping their under the surface channels clear. But then, you know, other people saying, well, there were too many leaves and they weren't doing enough cleaning on the road surface. Do you think there's any issues there about link up and collaboration?
If I could come in on this, Chair. So as members will know, the Mayor, after last summer's flooding, surface water flooding, brought together senior leaders from the Environment Agency, Thames Water, the London Resilience Partnership, LFB and London Councils. And I think the most useful thing that happened was that people stopped blaming each other and started coming up with solutions. So I think there was a bit of, well, if you hadn't had plastic bags in the gullies, then the drains would have drained things away and so forth. And there was a bit, and I hope partners don't mind me saying this, there was a bit of like, it wasn't our fault, it was your fault. And I think we shifted it from that. And Shirley Rodriguez and I have sort of continued to chair the roundtable over the last 6 months or so. And we had our most recent meeting, I think it was last week or the week before. And I think that the emphasis has been on what practical measures can be taken, what can be changed to try and make sure, and I will say try and make sure we don't see repeat incidents this year, because I mean even this week we've seen pretty heavy rain in large parts of London, which sort of has me sort of slightly sort of nervous. But I think that the most useful thing that has come out of it is an understanding of the need to have very clear lines of communication, both between partners when something happens, but also in terms of very clear messaging to the public. And London Council's reported, for example, that they're doing a piece of work to make sure that there's consistent messaging across the borough websites. And the LFB Comms Director is actually sort of taking lead on some of this, and also making sure that there's links between the different websites, so that whichever website people go to first will take them through to the information they need if there is an incident. But I think obviously that prevention piece is key, and sort of unpicking how you can stop things happening in the first place. And I think that Andy brushed over the Chelsea Flower Show display, but it actually has won an award yesterday, and I sort of think that actually the more imaginatively you can present the ways people can help themselves in terms of trying to prevent things affecting them in the first place, the less there is for people to have to respond to ultimately. And I think it just helps raise the profile of the issues. So anybody who can get along to Chelsea Flower Show, please go along and see the LFB stand. Thank you.
Okay. Thank you very much to the Deputy Mayor for that additional response. Thank you, Chair.
Thank you. Assembly Member Polanski.
Thank you very much. Commissioner, we spoke earlier about more London-wide in terms of the impacts of climate. Looking more kind of local now at the Brigade's own climate impact, how much of an argument do you think there is that more investment would mean you could build capacity now to get that down?
I think it's a very strong argument for that. And we, I just signed off actually on a strategy that again will be consulted on, will form part of CRMP about getting us to carbon net zero. So, you know, we think we can do it, but it's about the levels of investment that go in. And that's everything from greening our stations to making sure you've got a charging infrastructure if we do get an electric fleet. And don't forget, if we did, we would be the first service in the world to do that, because the prototype, if it works eventually properly, should be the first sort of zero emissions pumping appliance. We're looking at everything from going now to biodiesel, because we know that we can significantly improve our carbon footprint by doing that, although there is still obviously an issue with emissions. I wouldn't be naive enough to suggest otherwise. So I think the strategy I've seen is really encouraging. It, for the first time for me as Commissioner, put some kind of boundaries around what it's likely to cost and what our different options are. So it can give us a staged approach to get there. And it'll form part of the conversations we have with colleagues on this committee, with the Mayor, who's very serious about the levels of investment both needed and his ambition for the wider GLA group. So I'm expecting support in that area, and we have got a plan to make sure we get to carbon net zero with different options.
And if the kind of driver on demand is climate, in terms of our best ability to scrutinise, do you think that is looking at capacity or investment?
I think you've got to challenge us on both fronts. I think you've got to look at us in terms of our ability to respond, the maturity and kind of professionalism of our plans to do our own bit, and then I think supporting us in seeking investment to deliver against both of those things. I think in terms of capacity, I think we've got the capacity as a brigade to respond. There's something in about how we respond, how we continue to grow people's skills, how we help our own people understand the changing profiled risk in London so that they understand this is a significant thing. But in terms of stations, we've got a plan. It's about investment. I've got some really good people in sustainable development now. I've got a lead in property who's very, very serious about this. We need the inward investment, and we need to make best use of our own resources to make sure that we drive efficiency where possible to reinvest. That would be my answer, I guess.
Thank you. Deputy Mayor, did you want to come in at all on the investment point?
I think Andy's covered it, but I think that we'll be having discussions with the brigade. I've already spoken to Shirley Rodriguez and her team about the draft strategy, and I'm due to have. I haven't had a conversation with the Commission about it yet, but I think they're really keen to work with the brigade to make sure that the investment that's required is available, but also it's about the sort of making sure that you get the momentum behind these things as well. And what I would say is there's so many different things that the brigade is having to focus on changing, that it's about sort of making sure that when I have my regular scrutiny sessions with the Commissioner, or we have the informal sessions, that we actually make sure that all the different elements of change that are in the pipeline are given the appropriate weight, because otherwise I think the most immediate issue that he's having to deal with will be the one that is addressed. And I think it's about making sure that through the lifetime of the community risk management plan, all the different elements that will bring the brigade forward over the next few years are given appropriate weight in terms of the emphasis we discuss them, that we push them, and that we don't lose sight of the fact that if you just address one of the issues that we're having to address, then the other ones will sort of come back and bite us pretty rapidly.
Yeah, they're definitely interconnected. Thank you. Commissioner, the 12-month rolling average time to answer an emergency call more than doubled from 3 seconds in January 2022 to 7 seconds in February 2022. What caused this increase, and is it now getting back on track?
It is getting back on track. That's primarily down to cover, staff absence, some change in procedures as well, because don't forget, one of the things we learned post-Grenfell is that you need to interrogate and communicate in a slightly different way. So it means sometimes our people are on the phone slightly longer as well, which again has an issue then around being free to answer other calls. We're still, whilst no one ever wants to see a kind of downward picture in that area, we are still pretty much the quickest people to answer an emergency call across the emergency services. But again, I would expect to see that return to the sort of levels that we had previously pre-COVID, but particularly as staff absence, I would hope. This is where it is all linked together, as the Deputy Mayor just said, as those absences reduce and we get the full cover we need.
Well, thank you again for your work. Thank you, Chair.
Thank you. Assembly Member Moema.
Thank you, Chair. My first question is to Andy, and it is that the LFB's targets for home fire safety, educating young people, and time spent on community safety were, as you already said, affected by COVID, and they are still off target. So they're about 40% under the target, at 40% of the target at the moment.
Are we talking about, time spent on community activities or home fire safety visits? Apologies.
So it's the three, it's a three-part question. So home fire safety visits, educating young people, and the time spent on community safety. So the three things.
It's all COVID related, which is basically, so it's two-pronged. One, we weren't doing it in the same way during COVID, because to be frank, we were doing other things as well. So some of the resources we would have had doing that, we didn't have access to people's homes. They didn't want us there in that way. And we had obviously 600 odd people out on the ambulances. We're starting to see an uplift. I expect that uplift to be maintained. And to be honest with you, we need to, through CRMP, to really challenge ourselves as to, and you've heard all the kind of talk around community engagement. We need to challenge ourselves both around the type and the level of engagement we do. So I expect to see the metrics in those areas change significantly, make better use. For example, if you think about HFSVs, triage them better. Most people will get the advice they need, and we've had this feedback from the community digitally. And then you reserve the actual in-person visits for the most vulnerable, for example. So I think you see different targets there. In reference to HFSVs, we had a backlog of about 6,500 actually. We've closed that down to under 700 now. So I expect the next time we report to see it very significantly improved. But I think this is a changing landscape full stop that CRMP needs to better articulate, because what we're working to really is a set of metrics and targets that spoke to a previous era, and they're important. These are very important tools, but we need to be more intelligent about how we use them. Don't just chase the numbers, but really explain to you as a committee the quality of what we're doing. So the answer is yes, I need to see more activity now we're getting back out there and people will actually let us back into their homes. I need to see those figures improve, but I think we need to be transparent with you about how useful we think some of those targets are and set ourselves more challenging, different targets focused on a different way of engaging. That's what CRMP is.
Yeah. Okay, thank you. And just on the comment that you made earlier about your engagement and kind of risk, and this bit about working with people and engaging directly. Stamford Hill is in my constituency, and I think one thing I would reflect is that year on year, Purim, which is very particular to the Haredi community and the way in which they celebrate, has got incrementally less kind of hold your breath about things. Yeah. I think the risks have been managed a lot. But I wonder how, that is one example, but obviously there'll be other examples across the capital of people that have particular cultural or social reasons, or it might be something really as simple as they can't afford lots of data, so they're not going to engage with the digital campaign. How you would make sure that particular risks around where they're located, that point about, you know, the cost of living crisis and its impacts on people and the risks that people are taking, how is that going to be reflected in the CRMP? Because I think that's a really great way to close those gaps, but yeah, if there's something in addition.
Completely agree. It's about a proper assessment of risk for a start that's driven from two directions. So so if we're talking about faith communities as a particular example, number one, our own understanding of faith communities driving that assessment of risk. Number two, proactive engagement with every single part of the faith community network in London. So actually writing down who we're going to go and talk to and then going out there and talking to them and going as far as possible and understanding that changes. It changes with ways of immigration. It changes with kind of changes in evolving religion. I mean, what I would say, you know, it's very interesting sometimes when we talk about difference. One of the singular uniting factors of faith in London is that everyone likes setting fire to things. Literally everyone. You know, it doesn't matter whether you're Christian, Hindu, Sikh, Muslim, Jewish, you know, literally everyone either wants to light a candle, light a fire. So my actual experience of this is that in so many ways there is so much commonality in faith in terms of our intersection. What we need to do is make sure, and I think your challenge is right, is for those faith groups who we seem less of, who we haven't always had the confidence to really step into, places like mosques, I'm afraid, you know, we haven't done enough stuff inside them, then, you know, we just need to get out there and really understand and take that message and demonstrate that we are genuinely a service for all of London.
Thank you. I was just thinking about that. Everyone's with their fireworks and their candles. That's very true.
It's everyone.
Everybody loves a candle. So my next question, I think possibly my final, is for the Deputy Mayor, and that is that at a meeting in February, I understand that you said that that there was work underway to review the current community safety indicators, and looking at the notes, you said that there would be outcomes based, and it'd be really good to have an update on what progress we've made to date. Obviously, we've talked about the CRMP, but
it is the metrics within the consultation. So those will be published alongside the consultation, but they're very much focused on making sure that what is measured is meaningful. I think that when it's not that all the measures that were in place weren't meaningful, but I think the way the Commissioner articulated it around sort of the home fire safety visits is actually what is it we're measuring. We want it to be outcome based. We want to make sure that the time firefighters or others spend on talking to people about how they can be more safe in their home leads to more positive outcomes for people. If you're just doing the numbers of times people knock on doors and do a leaflet drop, then you're not necessarily measuring the right thing. That wasn't a particular measure, but you have to make sure that what you're measuring is meaningful, but that should hopefully be reflected in the metrics, the draft metrics that are out for consultation. And I would say, as well as the document being out for consultation, we'd really welcome very strong feedback on the metrics, because obviously the metrics that the brigade produces will also form quite a large part of my scrutiny. It's also form quite a large part of your scrutiny. So what you want to see and why would be really welcome in terms of the feedback on that. Thank you.
Thank you so much.
Thank you. And then just before we close the meeting, Assembly Member Rogers has a question.
Thank you. Actually, got just a couple of questions for Andy about an event that took place, or an incident that took place on Sunday, actually on Hertfordshire's grounds at Potter's Bar. A bus caught fire, electric bus caught fire. I don't know if you've seen the footage. It's quite dramatic. And subsequently, 90 of the particular models of bus have been withdrawn. I know this happens on Hertfordshire's patch, but has LFB been in touch with Hertfordshire about this incident? Because obviously it has strong links to London, some of our buses going up in flames.
We haven't, but now you've brought it to my attention, we will. And what we have got now is a team that is looking at this. So again, one of the most significant criticisms from the Grenfell Tower inquiry is that we didn't do enough horizon scanning operationally in terms of risk. We didn't have a team that was dedicated purely to doing that and then joining up all the different bits of the organisation where it might pick it up. And genuinely, this is a place where we might get stuff we didn't know. We will take that back. So we've got a dedicated team now that I would expect to go out and talk to Hertfordshire, because that's a significant incident. One of the problems we face is there isn't a mature enough national system across fire to collect significant operational learning. It's in its infancy. So national operational learning is there. Joint operational learning is there as kind of digital systems, as a network of communication across the national service. But there needs a change in culture across the national service to share, because really what you want is Hertfordshire to put it into that system, and we interrogate that system regularly enough to say, oh, that looks interesting, that's relevant to London, which is going to be the place in the country which has the greatest take-up and therefore operational impact as regards alternate energy. So the answer is, thank you very much for telling us. If we haven't picked up on it already, I'll make sure we do. And we'd be happy to feed back in terms of what we found and what we think that means to London at a future committee.
Because firefighters in my visits to fire stations in my patch, they've expressed concerns to me about the training and their preparedness to tackle electric vehicle fires. I mean, is there any specific training that firefighters get now? Because obviously it's going to get a much bigger issue.
Yeah, so we're in the process of evolving training to meet that. So some of the challenges are, you need to do that practically. We will not get our hands on second-hand electric cars or vehicles to cut up because the technology is too new. No one's going to let us cut their vehicles up. So we're in a bit of a difficult place where we're cutting up old petrol-engined cars. I can tell you now that electric vehicles are built significantly differently in terms of composite materials, the kind of flow of electricity, undischarged current in it. So we're struggling with that at the moment, both locally and nationally, and looking at places where, we might be able to partner up. I had a very interesting suggestion on one of my station visits from, and this just shows you why you've got to go out and talk to your staff. There was a guy, leading firefighter on a station in West London, who knew the training manager for Tesla. So he's put us in touch with Tesla, and my hope is that we will start to, again, try and grow a sort of partnership approach to this, because we need also, there is a responsibility of the companies as well. If you build something, even if it's working now, you need to tell us. So we're looking at this across the piece. It's quite a big question. I think it's something you might want to explore at a future point, is how do we horizon scan? How do we work with people as various as the Fire Research Trust, NFCC, government, industry, to really understand emerging risk? Because what I would say, again, transparently to this committee, is we're nowhere close to where I'd want to be on that, either nationally or locally, because technology is outstripping fire services' ability to respond, both in the built environment and in particularly in the transport environment. I think we've really got to get a grip of ourselves. and challenge ourselves on that.
Thank you. One final question, Chair. On this particular incident, it sounds like there are going to be some lessons learned, which I guess Hertfordshire will lead, but will you be in touch with TfL at any point if there's any guidance you need to give them about how to correctly park and charge
yes,
their
absolutely. So, I mean, my prime example of that would be the scooter fire issue. You know, we'd picked up that there was, and it was only a small increase in trend at the time, we picked up right at the start of an increasing trend of scooter fires on the transport network. You know, we have really good relationships with TfL. You know, they've got some good people involved in risk on their side. We talk to them all the time. You know, I think within weeks we'd helped enact and then enforce a ban on scooters on the transport network. And we had long conversations about storage and an appropriate use of the technology that we do want to exist, because we want to green, you know, London's transport, and that's one part of it. You know, green cycling, electric bikes, really important. We want to support that. Just need it done safely. We need manufacturers to work appropriately. So yes, the answer is yes, we work very closely with our partnership bodies in London to kind of consider risk.
Fantastic. Thank you. Thank you.
Thank you. Thank you. And I realise we went up just a few minutes over, but thank you very much to our guests for all your contributions today. I extend my congratulations to you all on your Chelsea Flower Show Award, of which you seem very proud. You're welcome to stay. We just have a few small items of business, or you are also welcome to leave at this point. It's up to you entirely.
Yeah, we're happy to stay for that, genuinely. I just want to thank the committee for your questions, really, and the continued challenge you provide. It's right and proper. Thank you.
Thank you. Can we note the report and today's discussion? Can we also delegate authority to me as chair in consultation with party group lead members to agree any output from this discussion? Can we note the committee work programme and the meeting dates as agreed by the London Assembly at its annual meeting on 9th of May 2022? And can we note the additional activity undertaken since our last meeting, namely the visit to the Paddington Fire Station? Okay. The date of the next meeting of the committee is scheduled for the 15th of June 2022 at 2 p.m. in the Chamber in City Hall. I have no urgent business, therefore I declare this meeting to be closed.
Okay.
Yeah.